Over the past 8 months, more than 237,000 Howard County residents have been vaccinated against COVID-19. It was not easy to reach this point. At first, with limited availability of the vaccine, we focused on our most vulnerable, including getting our educators quickly vaccinated. As vaccine became more readily available, we expanded clinics, ran one of the most successful mass vaccination sites, and left no stone unturned to make sure our residents have the information and access to get vaccinated. We are thankfully in a place where we have an abundance of all 3 vaccines, but we still need to do everything in our power to keep our residents safe. Each person who chose to get vaccinated took an important step to protect themselves, their loved ones, and our community. Every person who gets vaccinated is significantly less likely to get severely ill or die from COVID-19. Although we currently have the lowest positivity rate in the state of Maryland at 2.8%, thanks in part, large part, to our vaccination progress, our case rates are concerning. And that is fueled by the Delta variant, which is more contagious than other variants and causing more infections. The people most at risk right now are the unvaccinated. Let me repeat that. The people most at risk right now are the unvaccinated, including members of our community who are not yet eligible to get vaccines. It is our responsibility as a community to get vaccinated to protect those who can't protect themselves. And I'm so proud and encouraged by the more than 86% of Howard County residents who have already gotten at least 1 shot. Now, we need your help to convince and support the remaining 38,000 of our friends, neighbors, and loved ones in Howard County who have yet to get the vaccine. Please share that vaccines are safe, effective, and our very best chance at beating this pandemic. Emphasize that the longer you wait to get vaccinated, the more likely it is that the virus will continue to mutate and draw out this public health crisis and cause lives. Today, we're here to emphasize the urgency of getting vaccinated to our community, especially to our kids as they prepare to head back into school buildings this fall. To date, nearly 79% of our young adults and teens have gotten at least 1 of their shots. This is incredible progress since vaccines became widely available at the beginning of summer, but there is still work to be done. We have clinics happening every day, many of which offer all 3 vaccines, and many are even available to walk-ups. Tonight, there will be a clinic right here at Howard Community College from 5 to 7 p.m. Again, there will be a clinic right here at Howard Community College from 5 to 7 p.m. tonight. So please bring your kids after work and get vaccinated. The more of our eligible children, students, and educators that head back into school buildings fully vaccinated, the safer in-person learning will be for everyone. Parents and guardians getting vaccinated helps protect those who are under 12 and not yet eligible. You become 1 less person who is likely to spread the virus. And as I mentioned before, everyone needs to act. Please take a moment today Reach out to someone who might still be on the fence. Help someone make an appointment. Offer to drive them to a clinic or watch their very young children. Let's support one another as we get to the finish line together. Some of those in our community need that support, need that gentle nudge, need a helping hand, and it's our responsibility as a caring community to lift up each other and get to that finish line. Thank you.
In Howard County, we have reached the 20,000 mark for total cases of COVID-19. Our average cases per 100,000 is 7.33, and our positivity rate today is 2.38 per the Maryland Department of Health. Over the past month, our positivity rate has increased 400%, and case rate has increased more than 500%. Fortunately, we have remained in the moderate range for community transmission, according to the Maryland Department of Health and CDC. I attribute this to Howard County's high vaccination rate. Currently, almost 70% of all county residents are fully vaccinated. But this means 30%, or about 97,000 residents, including children under the age of 12, are unvaccinated and vulnerable to becoming ill. The Delta variant, which we have certainly heard a lot about, is the predominant strain in Maryland and in Howard County. It is highly contagious and places unvaccinated residents at risk for hospitalization and death. Vaccination remains our most effective tool in combating this virus. In order to protect our community members, we must vaccinate as many eligible residents as possible. Despite our amazingly high vaccination rate, it needs to be higher. For those waiting for the right time to become vaccinated, now is the time. Delaying vaccination will only increase the risk of becoming ill, increase time away from work, increase time away from school, and increase your chance of being hospitalized or dying. Becoming vaccinated also protects those in the community who are either unable to receive vaccine because of medical issues or are too young yet to receive the vaccine. For our parents and eligible students, now is the perfect time to find a clinic right here behind me and get vaccinated so that when school is underway in just a few weeks, you will be fully protected. The health department and partners, including HCC, including Howard County government, continue to offer vaccination clinics at convenient times throughout the community. You can virtually find a place to get vaccinated from dawn through dusk, 7 days a week. You can sign up, walk up, or show up in whatever manner is best for you. We just want you to get vaccinated and protect yourselves, your family, and our community. Thank you.
Good morning, everyone, and I'm excited to be here for another vaccination clinic and to again amplify the critical nature of the COVID-19 vaccine for all eligible residents. First of all, I want to thank our ongoing partnership with our outstanding county executive, Calvin Ball, and our outstanding Howard County Health Officer, Dr. Maura Rossman, for their continued efforts to make vaccine doses available to our students, staff, and families throughout Howard County. We would also like to celebrate the fact that Howard County remains atop the state of Maryland in numbers of residents who are vaccinated. But as just stated, we are not satisfied. We can do better. Our infection numbers across the board remain low in relation to other counties and in the state, but that does not mean that the risk doesn't exist in Howard County. Our work is far from done. And now just remember, in 3 weeks, our school doors will open, and I'm so excited to welcome back our students for normalized instruction after nearly 18 months of not being in school at a normalized level. I am grateful to have our students and staff back in schools and firmly believe that providing in-person instruction for all of our students is the right decision and is the only decision. However, we need to stay very aware of the risk that the virus could spread in a school, requiring students and staff to be out of the building for an extended period of time. This is particularly the case given the spread of the Delta variant. Consistent with the Health Department advice, we will continue to require all adults and children to wear masks indoor and in our school buildings. However, the greatest protection we have for our students who qualify is the vaccination. I am here today to encourage all parents of students who are in our school system to strongly consider the vaccine for your child. The vaccine will greatly protect your child, help us keep our schools open, and reduce the spread of COVID-19 within our school communities. The Howard County Health Department has several upcoming clinics scheduled, and I encourage parents to go to the Health Department's website for more information and to register. And as stated, there is one tonight. Let's make it a priority and be there. I look forward to our continued partnership with the Howard County government and our health department as we focus on the collective goal of ensuring all of those who are able to do so receive the vaccine, and that we are opening our schools on August 30th, and our goal is to provide normalized instruction, keep our children safe, and keep our school system and community moving forward. Thank you very much.
Thank you, Dr. Ball, Dr. Rossman, and Dr. Martirano. I am so proud that Howard Community College continues to serve a critical role in the community with the vaccination clinic on our campus to serve both students and the Howard County residents. Howard Community College strongly encourages all students to be vaccinated against COVID-19. Among the initiatives that HCC has undertaken is a 2-hour vaccination clinic during our upcoming Summer Bash this Thursday, August 12th, an event for both our new and returning students. The clinic will be situated off our main quad in Duncan Hall, the heart of the campus, for 2 hours from 2 to 4. We invite current students, prospective students, employees, and the community to stop by and get vaccinated. Thank you to the Howard County Health Department for partnering with the college to make this special clinic possible. To further encourage student vaccinations, HCC is now offering a special incentive to eligible students who are fully vaccinated. Students who are enrolled and have an active HCC identification card with the current term sticker and who show proof of full vaccination will receive a $50 one-time credit to use in our HCC bookstore. More information is available about this on Howard CC /vaccination incentive. While students may use this credit for their books, they also can use it for other needs such as clothing, technology, or supplies. The credit is for eligible students to spend as our appreciation for them taking the important step to protect themselves and the college community. From the beginning of this pandemic, Howard Community College has answered the call to help, and we continue to do so with these additional efforts to encourage vaccinations for a safe and healthy return to campus. Let me conclude by saying we recognize that this past year and a half has been challenging for so many. Howard Community College is providing funding to students for the cost of college. We are also providing resources such as laptops, personal counseling, and food assistance to ensure everyone who wants to pursue an education can achieve their goals. Please visit our website for more information and also attend our Summer Bash on Thursday, August 12th. We look forward to supporting our students and preparing them for the start of the fall semester on August 28th. Thank you, Dr. Ball, for this opportunity to share what Howard Community College is doing to help our vaccination efforts.
Thank you so much, Lynn. Now, as part of our collective efforts to address vaccine acceptance in different communities within the county, the Health Department created a series of public service announcements aimed at encouraging all eligible residents to get vaccinated. Videos in the series ask the important question of why get vaccinated? Answering the question were youth and their parents, a 20-something-year-old chef, and an African-American vaccine trial participant. The 30-second videos are being released each week for the next 3 weeks, culminating in a final 3-minute compilation video. Now, let's watch the first in the Why Get Vaxxed series featuring the O'Neill Decoux family.
Social and emotional welfare for kids is really important, and this has been really tough on them.
I felt like I wasn't learning as much in high school.
For me, vaccinating is something I would do. It's been researched, it's been looked into.
The good far outweighs the bad.
Getting back to being able to spend time with friends, being able to go back to school in person was really important.
Making sure that they're protected at a younger age.
Having all of us vaccinated, it has been a relief.
And now I'd like to welcome Keith and Kristen Decoux, who are the parents that were just featured here on this video.
Thank you very much. My wife and I are really excited to be able to have this opportunity. We really believe in vaccination, and we feel that anyone who is able to have the vaccination provided to them really should go out and do that. That includes younger folks from 12 to 17, making sure that that occurs. And anyone who is uncomfortable about vaccinations needs to really reach out to their providers or anyone else that they trust to understand a little bit more and to be vaccinated. These other folks had really, really good professional statements in terms of statistics and all of these other pieces, and I'm going to leave that to them. But for us, we're really passionate about making sure that people do the right thing for themselves and the right thing for the community and all the folks that we are around and that we support. So, and I think that that's probably as much as we need to offer or provide at this point. And we very much thank you for this opportunity, and thank you to the Health Department for involving us.
Thank you so much, Keith and Kristen. Your passion is just so evident on why people should get vaccinated. And right now, those conclude our formal remarks, but we're going to open it up to the press if there are other questions. And for the benefit of those who are joining us on Facebook Live, I will go ahead and repeat the question once asked. Go ahead. For the health officer, Dr. Rossman, would you like to state the question?
Sure. In terms of heading back to school, is it a good idea for children to get tested?
Is it a good idea for children to get tested for those who are heading back to school? Dr. Rossman.
Thank you for that question. So is it a good idea for children to get tested? According to the CDC right now, testing is recommended for persons who are feeling ill and suspect they may have COVID or they have been exposed. The Maryland Department of Health is offering a surveillance type model for schools, and that's up to the individual schools and parents to decide if they want to opt in. So, going back to your question, the answer to parents out there is that if your child is feeling ill or there's someone in the family feeling ill, testing is recommended. If your child is a close contact of someone who is known to be infected, your child should be tested.
Thanks, Dr. Rossman. Other questions?
Question for Dr. Martirano.
For Dr. Martirano.
Interested in the vaccination rate among teachers and staff in Howard County Public Schools and what efforts are being made to ensure that there's sufficient vaccination levels among staff and teachers.
What is the vaccination rate amongst staff at the Howard County Public Schools, and what are the efforts to continue to get more vaccinated?
Thank you for that question. It's an extremely important question. As we started off our press conference and the introductory comments from Dr. Ball and Dr. Rossman, we have made vaccines a top priority for our educators. We had the majority of our staff members participate in receiving their first and second dose of the vaccines during the spring. Our initial surveys had us close to 98 to 99% of our staff were fully vaccinated. We also recognize through the process of attrition that a number of our staff members have retired this last year, and we have continued with the onboarding of our new staff members to make available to them the information for them to receive the vaccination. We know that there are many tools in our arsenal that we can use and we must use to prevent the spread, and one of those is keeping our teachers and staff members safe by encouraging the use of vaccinations. And I'm very pleased as superintendent of schools in Howard County that our teachers have been very willing to comply with that.
Thanks, Dr. Martorano. Other questions? Seeing that there are none, thank you to those who are joining us on Facebook Live, and thank you all again for joining us today. That concludes our press conference.